It has happened accidentally, the writing of this book. It is not a biography or an autobiography. It is only some memories. Memories about my childhood and memories about that 5 years, crucial 5 years. I got an opportunity to work in the cabinet of respected Comrade Pandrai Vijayan, Chief Minister, LDF government. I had the portfolios health, family welfare, social justice, and women and children development. Actually, I enjoyed that work. It is too difficult at that time. There are so many crises, and I learned some lessons in during that 5 years that every crisis brings us an opportunity and some experience also. We all become brave after a crisis management. Now, youngsters are asking, what is the crisis management actually? The crisis management is nothing but taking right decision at the right time and preparedness, team working, team forming. And during that 5 years, I learned that is correct. All this I have to practice during that 5 years. I gave some memories about my grandma and granduncles and my family. Actually, after my ministership, a call came from Delhi from the Juggernaut Publications. She asked me, are you ready to publish some memories of you, an autobiography? We are ready to publish it. I asked Comrade Sitaram whether I can give it to that publications or not. We are Communist Party members, ours is a cadre party, and if that publishers make any difficulties in that, you have to answer. That is why. But party is very democratic, and we are allowing anyone to write their experiences. And Comrade Ichuri told me that they are very progressive publications, and you can give the book to them. After that, Penguin Publishers also asked me, but at that time I have some commitments with these Juggernaut Publications, and I followed it. And one girl, one youth, that called Manju Sala Rajan, they insisted her, Juggernaut insisted her to write the book. I have to narrate everything to her. She is from Kottayam district in Kerala, Aymanam. I think you heard about Aymanam, Arundhati Roy's place. And Manju belongs to that same place. And I got a few days to narrate everything because of the hectic party work. We have every time we were engaged with our party work. And I got very few days to narrate these things. But online also we have some meetings, and I give the details to Manju, and she wrote that book in English. That is very nice. Everyone read that English version, and they appreciated Manju also to have, without losing the spirit of my experience, Manju wrote that book in a beautiful way. After that, Comrade Vimala asked me, why can't we publish it in Kannada also? And she want my permission. Vimala should not get permission from me. We are comrades, and Vimala can do that. But I have some commitment with that publication, that Juggernaut. I want to discuss with them also. So it became delayed. And Vimala was calling me every time. And at that time, I am calling that lady also, these Juggernaut Publications. And last they said, the copyright is with you and you can decide. Last they said. So I called Vimala, you can do that. And Vimala told me that Dr. Anupama is doing that. I am not very familiar with Anupama at that time, but I can't express my thanks to you, Anupama. Doctor, she did it in a very good way. She expressed that. It's a pity that I can't speak in Kannada or I can't read Kannada. I want to read it in Kannada, but I can't. In this age, I can't study Kannada language properly. But I can understand from the description made by Dr. Vasundhara, and also Dr. Anupama. The spirit of the book, and it is expressed in a beautiful way in that book also. I am very happy that so many discussions had this book. So many discussions is over, and the one of it was the Manorama family in Kottayam. Do you know the Manorama? They are here also, and they arranged a discussion. Manorama family. I think 50 or 60 people were present there. Most of them were not communists. I invited my party district secretary and also Minister V.N. Vasavan to that discussion. But all others are not communists, But during that discussion, all of them asked me about Communist Party and how I become a member of Communist Party. Why did you give the name My Life as a Comrade? Because my life is as a comrade, Comrade, we can use that word not only for communists, it is an international word. Comrade is comrade, Even Bhagavan Sri Krishna called Kuchela Sakhe. Sakhe means comrade, yes. And all the human beings should have the comradely relationship. We are thinking about that, So, how I became comrade? Here in this book, comrade means Communist Party worker. I am saying frankly, but how I become communist, that I am not speaking elaborately, the time is over. But my family was a communist family. My granduncles were freedom fighters, not great leaders. The workers in the village, they belongs to International Congress first. And they are fighting hard. Same time, they were fighting against imperialism and also against the feudalism, against landlords. At that time, in Malabar, Kerala, there are some customs of the feudalism, some systems of the feudalism that is not favorable to the poor peasants and agricultural workers and the poor people, Untouchability is the most ugly face of the feudalism, The landlords were saying, they were in the upper class, They are saying that all the miseries are due to the curse of God. The poor people believed that, Why you are suffering poverty? Why you are become downtrodden? They are saying, it is the decision of God. God decide that we should have everything, the wealth, education, everything. And God cursed you that you should suffer this poverty, misery, etc. But it is not true. Which God will decide like that? If any God decide like it, can we agree that? Can we worship that God? We ask the poor people, So it is something else. Something else means there is a division in the society. It happened in human society. Two classes. A few people become upper class. Not only as the caste or religion, but also according to wealth, finance. They acquired everything. They are few. They become capitalist. They become the landowners. They become imperialists and multinational corporates. They siphoned all the wealth. And the poor people had to suffer because of that. There is enough wealth in the world to fulfill all the dreams of the poor also. To solve all the problems. There are enough wealth. Gandhi also said that. There is enough wealth in the society, in the world. But we should know how to utilize that. If someone is very greedy and they are siphoning the wealth, the other part will become poor and miserable. So, Karl Marx and Engels, I believe in communism, and there is no need all the people who are assembled here should become communist, or I think you are from different thoughts and different ideology, no problem. But I read Communist Manifesto when I become young, and I heard these stories from my granduncles and grandma. Because during that fight against landlordism in Kerala, landlordism is like the slavery in Rome. There is a writer, a historian called August Bebel, lived in the time of Karl Marx and Engels. He wrote a book called Women in the Past, Present and Future. In that book, Bebel wrote that the landlordism in Malabar, Kerala was not formed at that time, Landlordism in Malabar is same as the slavery in Rome, There is a custom that the poor women, poor girls of the peasant family, they should go to the landlord's house before their marriage, the day before the marriage. Only after the breaking of the virginity by landlord, they can go to their own home or with the men who married her. The right to break the virginity goes to landlord. That means the land and the women are the private property of the landlord. The poor people have no piece of land to bury their body after death, So they unite. They unite according to this ideology, socialist ideology. In the Communist Manifesto, Marx and Engels wrote because of the division as the classes, exploiters and the people who are exploited by the rich. That is why the poverty is here. That is why the misery is here. And if the people who were undergoing this exploitation will unite and fight against the exploiter, you have nothing to lose but get a new society. We can have a heaven in the earth itself, We are dreaming about heaven. What is heaven? For a people, for a human being who is starving, the heaven means getting 2 times food, anything to eat. That is his or her heaven. If a woman is getting enough food, she's sure he is thinking more than that. Their heaven is different, But in our opinion, heaven is nothing but where we get enough food, very good food, and good education, and after that, good job, good wages, and no discrimination about caste or creed or color. All are living together, working for future. Only human beings can work for future, Only we can think about the society and we can preserve something to the next society, and we can work hard to save the earth, save the life of human being. So we should have to work together, every people. In that work, what is the need of caste discrimination? What is the need of color discrimination? We are all human beings. I am very, very much interested or excited by hearing sir's poem, Human body is a temple. Krishna and every god is staying inside our body. Then there is no discrimination of religion, Everyone can worship every god. But here, in the society, people are saying you can't worship that god. In Kerala, Yeshudas sing a very good song to please Guruvayurappa, Lord Guruvayur Sri Krishna. But she cannot enter that temple. She cannot go near to Guruvayur, Once nobody can enter, the downtrodden Hindus cannot go inside the temple. And there is Guruvayur Satyagraha in 1930s, 1940s, And after that Satyagraha, the poor people, they are known as Hindus, but they are lower caste. Comrade Krishnapalla fought hard. Krishnapalla go to Guruvayur temple and he reached the Sopanam and he ring the bell. But all the upper caste men came out and Krishnapalla had beaten by them, and he said the brave man will ring the bell and the cowards will beat him. Yes. That way we entered the temple. But now also something remained there, Hindu community is not allowing a Muslim or Christian inside. That also should be get rid of, If a man want to worship a God, whether it is Muhammad Nabi, whether it is Jesus Christ, or whether it is Krishna, he or she can do that, you know. That is the sense of the poem written by sir, you know, Chinnaswamy sir, you know. So I'm not going through everything. And in my family, that time, uncles become international Congress workers. And then they came to know about this Communist Manifesto, Karl Marx, Engels, socialism, that ideology, something published in our place in some newspapers, and some people directly go to Soviet Russia after the revolution from India to know what is happening there, what is the socialist revolution, and they witnessed the changes, inspiring changes in Russia after the revolution. They want to become free, and the agricultural productions, they give leadership to have more production, and after the production they produce these things, agricultural produce to all the peasants and farmers to eat. Previously they were not getting like that. In Kerala also, in 30s and 40s and 50s, the poor peasants are not getting anything, and the poor farmers fought hard against these landlords. The granaries are full, the landlords' granaries were full at that time, but the poor people were starving, who were worked hard in the paddy field and the other places, and slowly they become socialist inside Congress, and Congress Socialist Party is formed at that time. They joined at once to Congress Socialist Party. Later they joined Communist Party, and they suffered a lot because of that. Communist Party was banned at that time, even by the British, and just after the independence by our Congress government also. So they suffered a lot. That I explained in my book, what was the condition in my mother's childhood and in my grandma's living time. What is the condition of the society? I wrote about the untouchability, how my grandma, a village lady, she is not a very great leader or like that, but she got some classes from Communist Party, study classes. Through that she became brave, and she fought against untouchability in her place, and she became a prominent leader in that place. And also she fought against these infectious diseases also. The smallpox at that time, people thought it is a curse of a goddess, you know, Amma Vilayatam. They are saying like that. People is not dare to give the name or utter the name of the disease. They are calling it is disease only, not smallpox. Vasuri, that is the name of that disease in Malayalam. No one will go there. If a man or woman caught Vasuri, they will put them away from the houses, and some makeshift tents were made and put the patients there. They were not giving water to drink or anything. There are some people who is very near to goddess, we are saying Komaram. They will do some tricks by the turmeric powder, and they will not give them water to drink. That is the custom. Don't give any water to that patient. Because of this sore in the throat, the people will die out of that also. At that time, my grandma went to that kind of houses, and she brought this turmeric powder from this Komaram, and she used that same powder all over the body of the patient. She know that this is infectious disease, we cannot touch the patient, and she saved several lives. That story inspired me a lot. Not only from her story, but the people who were saved by her, they were visitors in our house in my childhood, and they give the incidents. They said Kalyani Amma gave us second life after the Vasuri, this smallpox. So I get interested and enthusiastic by this kind of experiences that grandma told me. She was a very good storyteller also. That is why I explain more about grandma in my book, you know. Not everything. There are so many things in a book. We can put little things not elaborate, then the pages will become increased. So the second part, that kind of things, how my mother suffered at that time, my these aunties, and what was their life at that time. And slowly I came to this party and I became a worker. I was too shy in my childhood, and in my youth also I am little bit shy, but she prompted, grandma and uncle prompted me to go outside to participate in social work and to do something for the poor surrounding in the surroundings. That is the way I become a party worker. I am a simple party worker, not I didn't have any very much sacrifice for the party or like that, because my period the situation is somewhat okay in Kerala. After 57, there are so many reforms in Kerala, and there are so many issues, but the situation is entirely different from that 30s and 40s, Second part, I have these experiences. When Nipah virus occurred, I was little bit afraid, all of us, and I also. When I heard the virus is the peculiar virus, and one family member, 4 members of one family got some peculiar symptoms, and they are going to die. One died, and the other 3 are going to die soon. And we examined what is that. From the lab, the result came, it was Nipah virus. I don't know what is actually Nipah virus. I heard about that. I googled throughout the way I am going to Kozhikode, knowing this thing, and I found that this has occurred in Bangladesh first, near the river Sungai Nipah, and from that river's name, the virus got that name. It is a highly infectious, and the mortality rate is too high. And what we have to do? We have to decide. As a science teacher, I know that we should not allow the virus to spread. That is the most important thing, To contain this thing, And I discussed with my doctors and secretaries, and we decided to contain the virus. We took all the measures. I have some meetings in the medical colleges. The first day, it was very crucial. The doctors in the medical college and nurses were little bit afraid of that, because Kozhikode Medical College is becoming an atom bomb, and there we are having our isolation wards for Nipah virus. And when I entered that conference hall, everyone was nervous, and they were looking like that. I said, it is our duty of the health community. I can't ask someone other, I can't recruit other youths or someone from outside, because this is a health issue. Only we can do it, We should have it. The ultimate aim is to save the life of human beings, and we should be ready. And we prepared them to wear, not doctor's opinion. I appreciate your opinion. If we are very alert and we are using mask, or we are keeping away from this virus, and we are washing hands often, no need to wear PPE kits. But we cannot be so much cautious during this, so much patients are coming. So the donning and doffing of PPE kit, vigorous trainings throughout the day, one day, we trained all the doctors and nurses how to wear and how to get out of this PPE kit and everything. I'm not explaining. So the preparedness, that is the most important thing. Team building is the most important thing. Making right decision, yet not hesitate. So many opinions will come from the society. Even in the COVID period, someone said mitigation method is good. In assembly also, opposition said that, teacher, what are you doing? All the countries are using the mitigation method. Let us allow the virus to spread in the society, and after that we will get herd immunity. I answered that there is a science in that, correct. If everyone caught virus, the herd immunity will be there. But Kerala is a thickly populated state, and the above 60 population is more than 20%. They are comorbid, and if we allow the virus to spread in the society, most of them will die definitely, So we have to protect that community above 60. So we decide to have not the mitigation method, but the containment method. That I wrote in my book. And several new reforms I can start, not I, we can start in health society. That also I wrote in my book. We are the first to have the antimicrobial resistance action plan. We are the first, Kerala is the first to have the cancer strategic action plan. And we are the first in India to have the total trauma care action plan. We started that. It is not completed, going on. The second Pinarayi Sarkar is going on, and the activities are also going on. We converted the primary health center to family health centers. We are giving priority to the primary things and protection, not prevention. Prevention and protection is the important thing. Curative part is also important, but we are always listening the curative part only. Prevention is more important. We wrote the copy during our childhood. Prevention is better than cure. But we are not listening to that part. So, I want to improve as a health minister the primary thing. The family health center, there is a very good garden in front of the FHC family health center. There is a very good reception inside. Very good nurses check up there. Very good immunization block, painting, cartoon paintings are there. And very good LED presentations to the patients. And most modern observation room, very good laboratory even at the primary level. We started that. That is the reform according to the modern situation. And the taluk level hospital, district level, we have cath labs in district level hospital. When I decided to start the cardiology section in district level hospital, someone warned me, you are not able to get cardiologists. What are you doing with these cath labs? I said, without entering into the water, we can't swim. So, we are trying and we give cath labs to 14 district government hospitals. And now we got cardiologists, angiogram and angioplasty is doing that. The people who have to go to medical college too much away from their place, these cath labs are saving their lives, stress units, etc. That it is for people, I started a mission called Hridyam for the congenital heart defects. I want to reduce the child mortality rate. When I take oath as health minister 2016, the child mortality rate in Kerala is 12 out of 1,000 live birth. It is the lowest in Kerala, And we didn't sit with that first place, We want to make it single digit. And we started several projects on that. One is Hridyam, to save the young ones, the newly born child from congenital heart defects. We will at once be there in the hospital and took the child to the operation center and get operated and send them back after cure. So, this kind of project helped us to reduce child mortality rate. I don't know whether you believe or not. 2020, when central government examined this thing, Kerala's child mortality rate is 5 out of 1,000 live birth, from 12 to 5. Maternal mortality rate from 67 to 19. Actually, we have a slogan at that time. We raised a slogan that 30 by 20, 20 by 30. What does that mean? We will reduce the 67, that rate of mother mortality rate, maternal mortality rate to 30 by 2020. And by 2030, we will reduce it to 20. That is 30 by 20, 20 by 30. But we reduced it to 19, below 20, even 2020, at 2020, So, I am not speaking. When I spoke about this health sector, I can't stop because I am so much interested. I have a feeling that I belong to health community. Whenever I saw a doctor or a nurse, I am thinking that he belongs to me. That was a very interested, very inspiring work. Difficult work, but very inspiring during that 5 years. And I mentioned something in this book, and that 2020 was a crucial year. All the world listened to us, It is not because of any person's peculiarity, but it is because of the public health system in Kerala. We have a very strong public health system in Kerala. I remember that during that COVID period, Karnataka government once said, in the newspaper it come, only God can save Karnataka now. Someone said like that. People are dying. At that time, death rate is too low in Kerala because of this containment method and because of the pre-planned work. We started not only containment but also break the chain. That was a very flagship program of Kerala. Break the chain, how to wash hand and how to use. We prepared so many instruments to get hand washed and get the virus away from that from the premises. So everyone appreciated us. And 2020, one more thing. Some people suspected that they are not giving the death rate properly, hiding some deaths. They said, like some newspapers, every time some medias are like that. They can't believe the good things. And someone asked me, only below 5,000, how can we believe? Then I told them, you please check the total death in 2020. Except that the analysis had done by some central agencies, not only in Kerala but throughout the world. But Kerala is the place among 4 or 5 places around the world. Excess death is too low in COVID period. It is low. It is lower than 2019 total death. Total death in 2020 is lower than 2019 total death. How it happened? If COVID death is more, every place, even in America, excess death increased because of the spread of COVID. So I am concluding my speech. That is written in it is not a I cannot say it is a great book or too much about that book. I tried my best to give some experiences in that book. If it is interesting or if it inspired anyone, some doctors have said it is inspiring. Some nurses have said it is inspiring because it is about them. It is about their work. The real heroes are behind the curtain. They are actual heroes. And all the awards I got, that is to them, my team, the brave people around me at that time. And if the book inspired anyone, I am so lucky and I am blessed with that. And again, I can't express my thanks in words to Comrade Vimala, who took the interest to translate it in Kannada, and Dr. Anupama, who did it with very interesting manner. And you all sit here without the discrimination of political parties. You belongs to different parties. I know you. I know. Vimala told me all types of believers or a very different ideology. You believe in different ideology, no problem. We are all human beings. We are all working for a common cause. That is the comfort of the society, to increase the happiness of human being, to make the life in the earth more beautiful, to reduce misery and get more happiest things to us. That is the dream of each and every human being. How to achieve that thing? That is the question. And we should have to answer that question. I decide my way. You can decide yours. But all of us have to answer these questions nowadays. Without the wars, without the religious riots, and without the killings, how human beings can work together for the next future society.